Hello, this is Nurse Dayna from SeeBeyond Medicine. And today I wanted to take a few minutes and review one of our functional medicine tests that we do often on our patients. The lab is called Doctor's Data, and this is a heavy metal urine test. We use this pretty often. I think everyone realizes heavy metals are kind of everywhere, right? They're in the food, they're in the water, they're in the environment, they're in beauty supplies, they're just kind of hidden in places you would never know. And so at See Beyond, we look at root causes of why somebody is not feeling well or, having imbalances in the body. And heavy metals definitely play a big role. So I wanted to do a few things and just kind of show you what the test looks like and how we go about doing heavy metal detox removal as well. So this is the test. These are all of the heavy metals that are tested. And what I love about this lab is that they give us a green, yellow, red zone. So it's pretty clear if you've got levels that are, safe or safer levels versus, toxic levels. And this is how we really analyze the progression of someone as we're doing heavy metal removal. So we always do a pre and a post when we're doing chelation. And chelation is just a fancy word for heavy metal removal. And what we usually do is we do a pre, so we have it, baseline, and then after our protocols, we repeat to see the changes and get a better idea of the heavy metal burden going on in someone's body. So a couple other things I wanted to show you is first, yes, we want to see what the level is in someone's body, but then we also want to look further and say, okay, where did this come from? And I love this test because they do uh, really go into detail as where this heavy metal could have been, like where the exposure could have been, whether it's a past exposure or a present exposure, and then also what this heavy metal, what type of toxic effect it can have in the body. So a lot of, connections can be made if you're having these random symptoms with no answers. Sometimes we can relate it to the heavy metal burden that's going on. So it does really help figure out if the exposure is past, if it's present, and if it's present, our patients are making some big changes. Maybe they're changing, a water filtration system because, their water is contaminated. Maybe they're really completely removing certain products that they're using because they are full of aluminum, like, deodorant. Most deodorants have aluminum. Maybe they're changing their pots and pans. Maybe they're changing their diet. Mercury is really, a big problem in the fish supply, especially in tuna. So it's just awareness. It's like you don't know what you don't know. And this test really gives us the opportunity to really look a little further into someone's personal environment and make sure that the exposure gets stopped. And then, the other part of this is let's get this stuff out of your body. And then how do we do that? So I'm going to go through those a little bit so that makes sense. But one thing I did want to say is, we see certain heavy metals come up all the time, but the top three that we see kind of on everyone, it's kind of safe to say, on most people is aluminum, mercury, and lead. Those are probably the three biggest problems and it's just the matter of those being the most prevalent, like in our environment, like aluminum being in so many products, really hard to avoid. Lead, was widely used for so many years with paint, but then also with pipes. And then mercury, like I mentioned, the fish supply. So it is really, really valuable information about what's going on in your body. So you can make some really important health decisions. A couple other things to go over now is what do we do with this information, right? So there are two types of chelation therapies that we use at SeeBeyond Medicine. One is oral, one is IV therapy, and they are both super effective, one being a little bit more than the other, depending on the heavy metals sometimes. So what we typically do is we do a 12-week protocol where we do our first pre-test of what you're looking at here, and then we will check it again after the 12 weeks of chelation. So the oral chelator that we use is called DMSA, and the IV chelator that we use is called EDTA. We find they both are great. IV therapy is always more effective no matter what the conversation is versus oral. So, it is usually recommended more depending on the burden in someone's body. We do typically, when we're seeing a lead issue, see better results with IV versus oral. Lead is a little harder to move. Mercury, aluminum, the neurotoxin sort of heavy metals, definitely we see good improvements with DMSA, really both, but everyone's different. So what happens is the provider, looks at this result and then makes a protocol depending on what's going on with the patient. Couple other things to mention is we love using also in combination with detoxing is one of the most potent antioxidants is called glutathione. Glutathione is just really effective helping with assist in the detox pathways, especially if someone has trouble detoxing. Heavy metals, we're really not supposed to be ingested, right? Our bodies are not equipped to break down heavy metals and detoxify heavy metals. So what happens is the body just decides to store them and says, okay, I got to put this somewhere. And that could be in the brain. That could be in the bone. Lead is very commonly, found in bone. And connected to osteoporosis. Mercury and aluminum very connected to like neuro symptoms like brain fog and memory loss and things like that. So, we do really want to pay attention to what's going on with someone and then also looking at their detox pathways. So for instance, if somebody has the MTHFR gene mutation, they really might not be detoxing well, or I should say methylating well. So giving them some assistance is also really helpful. We do like to also use a supplement called NAC and acetylcysteine. This is the precursor to glutathione. So again, also helping with like the detox as well. Some other really big tips for our patients or anyone that's going through a heavy metal detox is sweating. So how do heavy metals come out, right? We pee them out, we can poop things out, we could sweat them out, we could breathe things out, but sweat specifically is another really added bonus. So we do recommend sauna use as somebody is going through the detox as well, or just in general, just like a great detox support is using infrared saunas. I do like to go into where these toxins are, where they are in the environment, and then, what we do about them. They are really on an individual basis, but just in general, if you were curious, take a look at all of your beauty products. Take a look at anything that you put on your body, anything you're absorbing, inhaling, ingesting, anything that could be getting into your body, and take a look at the ingredients. There's a really great resource called the Environmental Working Group. Their website is ewg.org, and they are so great with giving an analysis on how safe a product is. I use it so much trying to find great products for my kids, or just even like sunscreens or laundry detergents, things that we use every day that we don't really think twice about, but is causing, exposure to some pretty toxic stuff. there's so much more we could talk about when we talk about toxins, but I just wanted to give like a nice overview of this test. And please feel free to call us and schedule a free consultation if you have questions, or, we're here to help you and get you in your best health. All right. Hope this was helpful. Thanks.